So, Doctors Owens, we're done with the course. The weekend's over. Mm-hmm. How do you feel?
Well, this was the most awesome learning experience I've ever had concerning implants. I've been in practice 33 years. I've taken about 7 implant courses throughout my career. I've been to Dawson, Arkansas, and a few others. I have to say that most of the implant courses I've taken, I've never had the confidence to go in my office and place implants on myself, and this was a great learning opportunity because I was able to bring my own patients here and place 5 implants on my own patients, plus do a bone graft and a membrane. And the quality of care was impeccable. The mentorship and the instructors were unbelievable. I've learned a tremendous amount, and this is the only implant course I've ever been to that I would say that I have confidence to go in my practice and perform this procedure, with great confidence and ability and skill. And I just really appreciate the opportunity. And if anybody out there wants to learn how to place implants, I would highly recommend this course to anyone who would be interested.
Awesome. So you were talking about the instructors. I mean,
right.
Like, give us an example. What type of procedure did you do that you felt you were incapable of doing, but you actually did?
Well, one procedure that I did this morning was to place 3 implants in an edentulous mandible with laying a flap from retromolar pad to retromolar pad, flattening out the mandible. Placed 3 implants in the area of the 2 cuspids and lateral incisor. We were able to dissect with a blunt gauze the mental nerve, and we were able to measure the anterior loop of the mental nerve and place them with complete confidence of not causing nerve damage, to the anatomy of the area. The other thing that we were able to do this afternoon is place 2 implants on number 19 and 30, with no problem. Yesterday we had a difficult case. It was my first case placing the implants.
Yeah. And
we had to do an extraction, surgical extraction on number 32, bone graft and membrane, place implants in the sites number 30 and 31, and make everything parallel for a good path removal insertion. And we also did corrected an infected root canal tooth that we had to enucleate a cyst that was next to the floor of the sinus, and place a bone graft and demineralized bone matrix and a membrane. And these are all procedures that I would have never done on my own in my practice. And the mentorship and the instructors just helping, and the tips that we learned and the surgical techniques that we learned were just beyond explanation.
Excellent. I don't think anybody really said it better. that was awesome.
Yeah.
Reese?
So I'm Dr. Reid Owens. Got to work with my father throughout this weekend, and it's great to share the camaraderie that we have. But more so, got to reconnect with a classmate of mine. I just graduated almost a year, or a little bit over a year ago. So it's great to be put back into this academic setting. I mean, I thought of it as being back into the residency floors at LSU Health Science Center up in oral surgery or perio, where we have colleagues of more experience showing us the technique, surgical technique, as well as the restorative concepts of what we're aiming to do for our patients.
Right.
I had the pleasure of placing, just today alone, 4 implants, single unit implants on a patient to restore single unit crown and bridge. On a patient on the maxilla, we did a lateral window maxillary sinus lift, and we were able to place bone and place implants in that same region, same day. I always thought it was above my head, but I was able to scrub in, surgically assist, and surgically place the implants today.
Excellent.
Yesterday we assisted on the mandibular implant case. So yeah, overall, each of us placed 5 or 6 implants. Pretty great technique. We were taking post-op CBCTs. We had Steve Kent from CareStream here showing us how to read the imaging. Dr. Berg's office here showing us how to map out pre-treatment CBCT, post-treatment CBCT. Megagen staff with Joel here and his wife Emily here showing us how to use bone, drawing blood from patients, spinning it to get protein-rich fibrin. I mean, couldn't get any better than that.
Excellent.
I mean, it's unbelievable.
Excellent.
I
So,
recommend it.
So one word from you, both of you, to what is the word? Explain the weekend. What would you say? One word.
Unbelievable.
Yeah. I was just gonna say, amazing. Amazing. Yeah.
See, y'all father son, y'all think alike.
Unbelievable. Amazing. Glad
Awesome.
I did it. Glad I did it. Absolutely.
Awesome.
And
Thanks.
the assistant staff was impeccable.
Grateful to be here. Yeah.
The training and the ability of the surgical staff was, you know,
No doubt.
beyond belief, and just the camaraderie and the buildup of the confidence and the respect that each of us had for each other, and not only the surgical techniques but suturing techniques as well, and
Yeah.
everything was just one of the best implant courses that I've ever attended in my
Yeah.
career.
Awesome.
And a team of coaches too. I mean, with Doctors Vance and Sean were the two that we were able to work with.
Yeah.
I mean, very humble guys.
Yeah.
And they'll show you every little thing to look at. I mean,
That's the key right there. That's what our goal is. You know, making sure everybody goes home able to do this in their own office.
Yeah.
I would
Yeah.
never have had the confidence to do this without having the hands-on experience of you know, treating your patients, and not only that, but following the quality of care of the patients that we did treat. You know,
Awesome.
and being able to follow up on that care as well.
Right.
Excellent.
So,
Thanks, guys. I sure appreciate it.
Thank
All
you.
right.
All right, man.